In this video we are going to deal with juvenile idiopathic arthritis, and it is a group of juvenile idiopathic arthritis is a group of autoimmune arthritis disorder in there is onset of this of boy or girls is age of above 16, then there is the onset of this disease, and this to duration of more than 6 weeks, more than equal to 6 weeks, and it is unknown cause. Here is unknown cause. It has unknown cause. And when we look for the epidemiology of this disease, epidemiology. In epidemiology, there is 30,000 to 15,000 people in the USA, child in the USA suffer from USA, and it is most common chronic arthritis in child. When we look to clinical feature of this disease, clinical features are there is in the clinical features there is typically involves large joints, also there is oligoarthritis, more than 4 joints, and systemic features like fever and rashes. Systemic features like fever and rashes. And when we look for the anti-nuclear antibody, is so positive. And when we look for the rheumatic, there is rheumatoid nodules are absent. Rheumatoid nodules are absent, and there is a joint stiffness present. Especially in the morning. When we look for the pathogenesis, regarding pathogenesis of juvenile idiopathic arthritis, there is not fully defined, but shares rheumatoid arthritic features. And when there is also genetic predisposition. There is also genetic predisposition like HL variation, and there is also PTP and 22 gene mutation. mutation. And when we look for the immune involvement in this pathogenesis, there is also immune involvement. Involvement like T helper cells, cytokines. And when T helper cells release T helper 1, and there is T helper cell like T helper 1 and T helper 17, and there is a cytokines like interleukin 1, interleukin 17, and TNF, interferon gamma. Are in this disease like as a cytokine. When there is also classification like sub classification based on clinical. There is sub classification based on the clinical. Sub classification. In the sub classification, there is like subtypes. We are going to discuss again subtype and their characteristics. In subtype there is oligoarticular. In this there is like more than 4 joints, large joints, and positive and large joint with large joints and ANA positive, like anti-nuclear antibody is positive. And there is also like systemic. In systemic there is fever, rash, and hepatosplenomegaly occur. And there is another subtype. There is polyarticular rheumatic factor positive. That is resemble with adult. It is resemble with adult rheumatoid arthritis. And when we look for the polyarticular rheumatic factor negative, then there is like more heterogeneous. It is more heterogeneous. And there is another type like this is called enthesitis related in this direct involvement of ligaments, involves ligament, cartilage insertion, like it is known enthesis. And there is psoriatic. Another one is psoriatic. In psoriatic there is like family history. So this is regarding subclassification. So there is a treatment of this disease, juvenile idiopathic arthritis. Like there is same as what are the treatment for the rheumatic arthritis given. This is also given that inflammatory for the inflammatory cause. NSAID is given. Corticosteroid is given. Corticosteroids. And there is DMARD like methotrexate. And biological agent like interleukin 6 receptor antibody is given. like given is like tocilizumab and TNF inhibitors are given. It is regarding the treatment person. Then there is a prognosis. It is many cases in the chronic and 10% develop as a disability, like disability in 10% patient, and many have more common chronic, which is chronic. So this is regarding juvenile idiopathic arthritis. Now moving on the another diseases of the arthritis.